So again, we were talking about our tool use here. And again, what you're going to do is you're going to clean the area very, very good with alcohol. You'll come here and again to the fattier portion, and then you will press, okay? You'll take that blood out, and then you'll use a glucometer or some type of machine to check those glucose levels. Then you will hand your patient one of these or some type of band-aid so they can cover up that wound, that finger stick region. Okay, so that's very, very basic information on how to use these little tools. Please make sure you always wear gloves. Please make sure you always clean the area first. Now, let's get into your syringes here. Now, it is very, very important that you know how to use these syringes. I've seen a couple of brand new nursing students make a very, very critical, very, very high critical mistake when using these. Now, typically you're going to be giving dosages of insulin, for example, anywhere between 4 to 10 to maybe 12, maybe even 15 units of insulin. That'll depend again on your glucose levels. So you will have your vial of insulin. You will pop the cover here, you'll stick, and then you will draw the amount of insulin that your patient requires or needs. Now, if we turn here, you can see our amount here. Okay, so that would be, for example, 5 units of insulin. So 6 would be about there or so. 7, 8, so forth. 10 units about here. You get the point, 15 units here. So it's not a very large amount. Okay, now look at the needle, is very, very small. And this is for a subcutaneous injection. Now, that's about 15 units, so make sure that you're able to distinguish the correct amount versus using this type of syringe. I had a nursing student try to draw up 6 units, and they grabbed this type of syringe and they drew this much. This is not 6 units, this is 60 units. This would be about 6 units. So here is a huge difference in dosing as far as insulin goes. 6 units versus 60. You give 60 units thinking you're giving 6 units, you're going to cause very, very severe problems to your patient. So make sure that you know how to use these. Make sure you know how to draw the correct amount, because again, this is a small mistake that could have very, very severe consequences. So again, make sure you know how to use these syringes. If you don't, please ask your nursing instructor or the nurse that you're following that day. So please make sure you know how to use these. Again, when you're using these, you're going to pop this, clean the area with alcohol, and insert at a 45 to 90 degree angle. So again, that's how to use a little bit of the equipment, very, very basic again. Now let's talk about some drug therapy. Make sure you know these for the NCLEX exam. Number 1, rapid acting insulin. This will be something, for example, like Humalog or Novolog. Now, you will give this 0 to 15 minutes before meals. Okay, again, 0 to 15 minutes before meals, because this takes about 15 minutes to peak. And one thing that you have to remember is that this is a clear insulin. Number 2, short-acting. Should be something like Humulin R or Novolin R. Now this will be given about 30 to 45 minutes before meals. Okay, again, 30 to 40 minutes before meals, because this peaks at about 30 to 60 minutes. And again, remember that this will also be a clear insulin. Now you must know which ones are clear and which ones are cloudy. Number 3, intermediate acting. This would be like Humulin N or Novolin N. Now again, these will be cloudy in appearance, so make sure you know that, because this you have to shake or agitate. You have to mix, stir your little vial, your container, before you give it. Okay, so that is very important. Cloudy appearance, you must agitate, shake before you give. Now this lasts about 10 to 16 hours and peaks about 4 to 10 hours. Number 4, long acting. This would be something like Lantus or Levemir. Now these are typically given once daily sub-Q. These will appear clear. Now, one thing that you must know about Lantus or Levemir or the long-acting insulins is that you will never dilute and you will never mix with any other solutions. Okay? Again, you will never dilute the solution. You will never dilute these insulins, and you will never mix with any other insulins or any other types of solutions. Okay, that is very specific to the long-acting Lantus or Levemir insulins. The intermediate, the one thing you must remember about Humulin N, Novolin N, is that it is cloudy in appearance. Okay, so if you get, for example, the short-acting, and these are cloudy in appearance, that's a big no-no. You will not give that. So you must know that, again, the short-acting Humulin R, Novolin R are clear. Again, the rapid, the Humalog, Novolog, these are clear. Okay, so if they're cloudy, you have to throw it away. Now, what are some interventions that you'll have to perform for these patients? Number 1, before you ever administer any insulin, you must check their glucose levels first. That is a must. You will check glucose levels. Now this may be a C on HS before eating and before going to sleep. This may be every 4 hours. This may be every 6 hours. This will depend again on the physician, but you must check the glucose levels first before you give any insulin. Now, why is that? Well, because you want to monitor for hypoglycemia. If the patient is hypoglycemic, you do not want to give any more insulin because you will cause further hypoglycemia. So the very first thing you want to do is you want to assess that patient. Again, check those glucose levels. Now, if you do go ahead and give insulin, You must also still monitor for hypoglycemia, okay? Again, these patients are unable to regulate their glucose levels, so you have to monitor, you have to check them. You have to monitor for hypoglycemia because the insulin may have had a very good effect. Maybe the patient isn't eating. So again, you have to monitor for hypoglycemia. This would be anything below 70. Now, things that you will watch out for are shakiness or nervousness, sweating, anxiety, pallor, hunger. Big one is altered mental status, confusion, difficulty with speech. Again, you have to watch out for this because this kind of mimics something like a stroke. So this is very important, okay? Now, if hypoglycemia does occur, you will have them ingest 15 to 20 grams of simple sugars. So some juice, okay? And you don't want it to be anything like a cheeseburger. If they have confusion, altered mental status, they're very drowsy, they might not be able to chew, okay? The other thing is if it's a complex carb, it's going to take longer for your body to break down. So they're going to be hypoglycemic for a large amount of time. Remember that your brain requires glucose as an energy source. Therefore, if the brain becomes affected, again, you will have altered mental status. You will have confusion, difficulty speaking. So if you give something like juice, the brain will be able to go ahead and use that very quickly. So you'll give this, and then you will recheck the glucose levels in about 15 minutes, and again at 45 minutes, because you want to make sure that the intervention that you performed is actually having an effect on that patient. If the levels come back up, then you can go ahead and give something like peanut butter, some crackers, a small sandwich. Okay, but this is after, again, you have just given the simple sugar, something like juice. Now, if the patient's glucose levels did not rise, then you would give something like glucagon. And we talked about this earlier in the lecture, how glucagon causes hyperglycemia. So you would give 1 milligram of glucagon, and you can do this either IM or sub-Q. If you're going to do this IM, you will use the deltoid muscle, Now, one thing that you have to remember about glucagon is that glucagon causes nausea and vomiting. So you must remember to turn your patient to their side or put them in a semi-upright position. Again, this depends on their level of consciousness. If they're confused, not awake, then you want to put them on a side-lying position because you want to prevent aspiration from occurring. So you must remember that this causes nausea, vomiting. So prevent aspiration by putting them in a side-lying position. Turn their head to the side, okay? Please do that. Do not allow that patient to aspirate. Now, if the glucagon is not effective, then you would give something like dextrose IV. And here you would give 20 to 50 ml of 50% dextrose IV, and you would do this push. You would push it. You want to bring those glucose levels back up. Now again, you're doing this to bring that sugar level back up. So again, you would want to reassess their sugar levels. because you want to make sure if this actually had an effect of bringing those levels back up. Now, please, guys, make sure that you let the physician know immediately if the patient is unable to have their glucose levels come back up. So this is very important to make sure you inform the physician immediately. Other interventions that you will do for these patients is, one, place them on a diabetic diet. Now, this is very important because you must know what type of diet that is. You must educate your patient on that diet. I had a patient one time come in for very, very high glucose levels. And I asked, well, what do you eat? And she told me, oh, well, I eat very, very healthy. I take care of my diet. Well, the glucose levels didn't really reflect that. So I asked the family to bring me a typical meal from home. What they brought me was cheeseburgers, French fries, diet, pop, and a small piece of pie. That is not a diabetic diet. So if your patient does not know what that is, you must educate them on what that is. Low carb diet, okay? So again, place them on a diabetic diet. This is where education comes in very, very highly. You must be able to educate your patient, teach your patient, again, what the diabetic diet is. Number 3, you will check their BON and creatinine levels. Now, this is more so if they're going to get something like a CT scan that requires IV iodine or IV contrast. Okay, because we want to make sure that the renal function is okay, especially if they're going to get some type of X-ray contrast. Number 4, again, you will always monitor for signs of infection. And especially if this patient had some type of open wound, especially if this is a surgical patient, maybe had some type of knee surgery, hip surgery, or maybe they had an amputation, or maybe they have a recurrent wound, a non-healing wound. You always want to assess that wound. Is there any redness? Is there any discharge, any pus? Please always assess that site because, again, these patients have a decreased immune system.